Started on my ride about 3 o'clock in the afternoon. Was going to do about a 30-mile ride just to get in training for the next Alzheimer's ride toward the South Shore. I had left the house and gone my normal route through the Blue Hills. Had done the ride, was heading back home, and on my way back, I was about 3 miles from home when apparently the lights went out.
We were dispatched for an unknown medical and then updated as a cyclist down.
When we pulled up, saw the fire department was on scene and CPR was in progress.
He was unresponsive, not breathing. We saw that it was in ventricular fibrillation, and we defibbed him right there and got him back into a sinus rhythm.
We're en route to your facility, approximately 3 minutes away.
Prior to his arrival, we had prepared our critical care room. We had our emergency medicine and equipment ready for his arrival.
One of the concerns in cardiac arrest is that even though a person's heart may start beating again and they survive, that time that their brain was deprived of blood flow and thus oxygen can lead to permanent brain damage. We decided to protect his breathing and to intubate him so we could sedate him and obtain all the necessary testing, but start therapeutic hypothermia, which is a relatively new intervention where we drop a person's body temperature, and that increases the likelihood that they will have a normal neurologic outcome. As we were doing all of those things, members of the team were calling over to Beth Israel to arrange rapid transport.
He is stable.
Peter needed to be transferred to Beth Israel Deaconess Medical Center because it's a cardiac arrest center, and it really has all of the resources necessary to take care of patients in this condition.
I have no recollection of any of it, and all of a sudden I wake up and I'm in the hospital, and why am I here? I've never been in a hospital before. Why am I here today? And it was, it was about 2 weeks. I wasn't awake for all of it, but they scheduled me for the bypass on September 12th, which went fine. I mean, the surgery went fine. Dr. Kabaz did an excellent job. I've had people praise my incision, saying it's the nicest heart incision they've ever seen.
For someone who essentially died in the field and received such outstanding care and was resuscitated and diagnosed with this problem, for him to be able to have open heart surgery and leave the hospital in 4 days, this is certainly an outstanding outcome.
Our affiliation with Beth Israel Deaconess Medical Center provides us with access to a broader set of clinical resources that we can deliver into the communities that we serve.
It speaks volumes to the quality of care that was delivered to him and to the coordination of care.
We've decided to move our personal care physician and other medical specialties over to Beth Israel Milton because of that. I do feel good. I mean, it's still a little ways to go before I would say I was fully healed, but I'm lifting weights in a controlled environment.
It's very common to have a patient come from Beth Israel Deaconess Medical Center in Boston for their rehab here in Milton. It's a great advantage to have people be able to get cardiac rehab in the community. The focus of our program for all of our patients, including our cardiac arrest patients, is to teach them how to take care of themselves at home.
You don't push yourself. Take things in a logical fashion as you improve, and you just follow what they tell you to do. The advice, the instructions, excellent. Excellent experience.
There was an angel over him that day, from when he fell to us being prepared with our protocols and how we handle cardiac arrest.
A lot of people said it's a miracle, and I said, well, maybe it was, but I don't really think it was a miracle. I think it was the fact that I was able to get the appropriate care quickly, and people did an excellent job. It was medical expertise that kept me alive.